Hello and welcome to today's podcast brought to you by Mediversal Academy, where we explore cutting edge topics and challenges in the field of medicine. Hi, I'm Stephanie Prashad, the host for today's podcast, wherein we'll be covering topic which is a very crucial one called the diabetic foot, which is a major complication of diabetes, which often leads to ulcers and amputations. Joining us with us for our today's podcast, we have Dr. Alan Thomas, who is a distinguished MBBS graduate from CMC Vellore with a master's in general surgery and a fellowship in vascular surgery. He also holds a PG diploma in family medicine and is a respected member of ASI, AMASI, and CMAI. Honored as the best speaker at CARES 2022, Dr. Allen will share practical strategies for early diagnosis and effective management. So, hello, doctor. Welcome to our podcast channel, and we're really thrilled and happy to have you here.
Thanks, Daphne, for that wonderful introduction. I really feel honored, coming into your podcast channel, and thanks for inviting me. And I'm really happy to, have this discussion on diabetic foot, which is indeed a very major problem that many
Yeah.
diabetes patients face. So let's, without wasting any more time, let's just start off with the podcast.
Sure, really. Let's dive into the topic. And my first very basic question would be, can you just briefly explain to us what diabetic foot is all about and why is it considered as a significant complication for diabetic patients?
Right. So diabetic foot is actually a condition of foot problems linked to diabetes mellitus.
Okay.
Patients with diabetes mellitus, they have, foot problems. So they are having foot ulcers, and then that leads to multiple complications and comorbidities. So that itself, the foot problems in diabetes mellitus can be taken as diabetic foot. Why is it really
Okay.
important? It is because it has a significant morbidity and even mortality that is associated and with
Oh,
diabetes. And also, you should understand a lot of financial burden comes upon the family in treating
okay.
diabetic foot. So, as per studies, they say it's about 2.5% higher risk of
Oh,
people having diabetes, diabetes mellitus. The risk of mortality is higher than the patients who are non-diabetic.
oh,
Yeah.
okay. Yeah, that's really saddening to hear. So, in your experience, doctor, what are the most common risk factors that actually predispose diabetic patients to foot complications?
First of all, the very important factor is diabetes mellitus itself. Many of the patients go undiagnosed.
Okay.
They will just get some local trauma, and that it would not heal over time. And because of that, they would go to the local doctor. They may not identify the problem early. They will just treat it like a local infection or injury, and just keep giving antibiotics over antibiotics and over antibiotics. And you should understand that if diabetes, some patients, they may be the first to get it diagnosed because of a
Hmm.
non-healing ulcer in the foot.
Okay.
So
Okay.
once we treat the diabetes, the
Hmm.
wound ulcers definitely have a chance of healing up. I'm not saying it will always heal up, but definitely
Hmm.
it has a higher chance of healing up if your sugars are under control.
Okay. Okay. So, what are like some of the challenges that usually doctor face in the early detection of this diabetic foot complications, and like especially in the primary care settings?
So first of all, education of doctors is very important, or the healthcare provider is very, very important in identifying diabetic foot.
True.
First of all, they should understand if a patient has presented new onset, should always
Hmm.
check for his blood sugar levels and identify
Okay.
whether he has diabetes mellitus or not. So understanding the
Okay.
problem or looking at the wound ulcer, they should say that yes, that is most likely, a diabetic foot that is there, and that needs to be really looked into and sorted out. And his blood sugars have to be under control or made under control with using definite drugs to reduce his sugars. And if required, he may also be needed to be admitted to the hospital and to
Okay.
control his blood sugars, because as we know, increased blood sugars can also lead to formation of bad sugars called ketones, which can be
Yeah.
even life threatening.
Yeah. Right.
So that needs to be sorted out. And
Right.
yes, diabetic foot ulcers would require daily dressings if the
Okay.
ulcer deems so.
Okay. So doctor, as you mentioned that, the doctors really need to take care of it and diagnose it. So, like I would, I really feel that what if that the patients are also educated enough that they should, understand that, they are facing a certain major issue. So, how can they actually improve the patient's education regarding foot care so that they can help themselves to avoid certain critical conditions like ulcers or even infections?
So, what they do is, if patients are educated enough, definitely we also should run education programs. And foot care is very, very important in diabetes. The patient
Yeah.
may or may not have diabetes, but definitely he should have a foot care regime. That is, cut his nails
Hmm.
regularly, look for any ulcers or any small calluses that are there under the feet. And if there is any pain or anything, is there wear protective shoes. Do not walk barefoot. Very, very important for diabetic patients. If you're already diabetic, do not walk barefoot, because formation of an ulcer takes a longer time to heal. And so prevention is
Yeah.
always better than its cure. And sometimes
Right.
ulcer, if it progresses and if it's not controlled enough, it can even lead to amputation. So
Okay.
those things have to be very well kept in mind, and definitely use a moisturizer, and keep the always assess once a week or once a day.
Hmm.
Every day we wake up in the morning and wash our face. We look at the face
Yeah.
like that.
Right.
Make it a habit or a regime. Every day morning, or once you're
Hmm.
just returning to bed, just look at your feet if
Yeah.
everything is okay. There's no fungal infection or any skin discoloration or anything of that sort. Because many of the diabetic patients may not have sensations.
Yeah. Okay.
So
Okay.
if they don't have sensations, they will not know what actually injured them.
Oh, okay.
So that
Okay.
is one very important factor that needs to be known. If I speak from my own experiences, I had a few
Yeah.
patients in my OPD. They had
Okay.
presented usually during the winter season. So what they do is, we
Okay.
all have a habit of warming our hands and feet in front of the heater.
True.
Earlier, there
True.
used to
True.
be these fireplaces, and now it's all electric blowers and so on. So
Yeah.
these patients are actually diabetic, and what
Okay.
happens, as per the history, they were in this room and they were just getting into peak of winter, and Delhi is quite cold, so peak of
Yeah.
winter they were trying to Delhi and Punjab. So peak
Hmm.
of winter they're trying to get some heat, and the
Hmm.
relative who was in the other room found something burning, and it was actually the
Oh.
feet, the skin that was kind of burning. And these patients did not have any
Oh.
sensation because of the diabetes, and they presented with these problems. So
Oh.
that's also a formation of diabetic ulcers, that can form. And then we keep treating them, and controlling the sugars, and that took about 2.5 months to heal with strict glycemic
Okay.
control.
Okay. Okay.
It is
So
that
I'm
bad.
sure. Yeah, it's really bad. That means that we really need to be educated about these things so that we can take care of them at the primary stage itself, so that we can at least visit the doctors and take a good advice from them. That's so true.
Yes, definitely.
So true. So like as you mentioned that these are like you mentioned certain practices which we need to follow if regularly to take care of ourselves. So in that same way, doctor, like people who have diabetic foot ulcers, and these patients have actually poor wound healing thing. So how can they basically manage their diabetic foot ulcers?
So they need to visit a hospital regularly, and not
Okay.
just visiting a hospital will do. Definitely, they need to have strict glycemic control, have a good diet control, avoid sugars, and calorie intake has to be definite to visit. It's actually a multi-modality treatment
Okay.
that they need to undergo. It involves a dietitian. Everybody's role is equally important. It involves a dietitian, a podiatrist,
Right.
a surgeon, a vascular surgeon. Yeah.
Okay.
So, and of course, very, very important, the role of an endocrinologist who will definitely
Okay.
control the underlying sugars. So it's a
Okay.
multi-disciplinary team that is involved in treating diabetic foods. And yes, you need to visit the doctor early, adhere to what they say, and definitely frequent visits to the doctor and keeping the wound clean and hygiene. Very, very important. As
Yeah.
we know, foot is quite kind of an area that is dirty. So you need to maintain that hygiene. And if the wound is soaked, you need to undergo even twice a day dressings. And the family, it is always better if the next of kin or whoever is taking care of this patient learns how to do dressings. And it
Okay.
will help definitely, because what happens in many scenarios, then the attendant does not know how to do dressings, and this wound is exudating pus or fluid from these
Yeah.
ulcers. The whole foot is soaked with all this media, and then that itself forms a very, very culture medium for bacteria. So if they
Right.
don't know how to do a dressing, the next dressing would be either the next following day or 2 days later, or whenever the doctor is available. So you are giving
Okay.
a culture medium for the bacteria to grow, and it
Mm-hmm.
is becoming, the ulcer is not healing, but it going towards a downfall.
Okay. Okay. Great. So, like as we all know that the technologies and everything is like advancing at a higher rate. So, can you just shed some light on the latest advances in the treatment of diabetic foot, like such as new wound care techniques or the offloading devices or even surgical interventions?
Definitely. So, if you look at the starting from the basics, if they're looking at the PHC levels,
Mhm.
PHC is the primary healthcare center. So,
Okay.
identifying these patients, diagnosing early, controlling the sugars, very, very important. And yes, once an ulcer is formed, there's something known as offloading shoes that are present, because every time you walk on an ulcer, the ulcer is only
Mhm.
going to progress. It is not going to heal. So you need to
True.
offload that area and give
Okay.
it some rest so that the wound heals and there's no pressure on that foot. So what happens is you need to have these offloading shoes. It's these are all fancy names, but actually it is a simple way of offloading shoes is having a bar across the footwear. One, I mean, you can have it on both. You can have it at one foot, so that it is at a height and it's not touching the ground. And
Okay.
your ulcer is not directly in contact with the walking surface. So that is very, very important
Oh.
to know that use of offloading devices. It's quite an old technique, but definitely it has a
Mhm.
significant role in healing of diabetic foot. And the other newer techniques, of
Okay.
course, daily dressings. There are these
Mhm.
special, debridase ointments.
Okay.
Debridement helps in autolytic eating up of the cells and dead cells, pus cells. Debridase
Mhm.
ointments are there. So use that, and then you use alginate dressings, and those. There are multiple dressings that can be used for
Okay.
the wound care, and definitely you have to maintain hygiene. And of course, you need to even have what do you say? You can even have something known as vacuum dressing. So in that, if the
Okay.
ulcer is quite big, you apply this vacuum foam over it, and
Okay.
it's a small machine that keeps continuously sucking out the fluid. And there's a canister.
Oh.
It's a machine. So the patient was so once the dressing is done, it it is removed only after 5 days, and it's
Okay.
continuously, its battery is there, you can connect it to the power, and it's continuously sucking out the fluid and bringing the wound closer from the wound bed.
Oh,
So it is called vacuum assisted closure devices. So of course, those
okay.
are newer devices, but definitely it's little on the expensive end, and not all patients may be able to afford it. And
Yeah.
surgical interventions, definitely you should understand one thing, that debridements, the age-old technique of
Mhm.
debridements, that you're doing surgery, not amputations. Amputation is the last resort.
Yeah,
Um,
right.
we are not talking about amputations as such. Before
Mhm.
amputation,
Mhm.
you can debride the wound and see, in
Mhm.
debride, keep cleaning up the tissues, keep cutting the tissues till you see good blood flow. Good blood flow
Okay.
means good nutrition is coming to the foot. And once you have nutrition, definitely it will turn pink, and it will, the wound will heal, even though it will take time. So it's not
Okay.
just simple surgery that is there. After the surgery, a couple of days, you might have to put in a vac machine. So it is
Okay.
multiple modalities that are there that needs to be sorted out. And it is
Okay.
tailor made. And diabetic foot treatment is usually tailor made as per the clinician and his patient that he is treating. So that is one of the very important surgical intervention. And as a vascular surgeon myself,
Mhm.
definitely prior to amputation, definitely you should always, if the conditions are feasible enough, you should always
Mhm.
attempt for angio plasty, if possible, graphy plus plasty.
Okay.
That what in simple languages you would have heard for blockages in the heart.
Yeah,
So they
right,
do an
right.
angiography, they open up the vessel, they put in a stent.
True.
Similarly, in the
True.
foot, if the foot vessels are even finer, the foot vessels are smaller. So if there's a blockage,
Okay.
so you go in, you try to open up the vessel, improve the blood flow to the area, and
Mhm.
once and maybe you may or may not put in a stent. Of course, that is totally clinician's on table decision. And once
Okay.
that is done, once that is
Mhm.
done, happens is, even if the patient has to undergo an amputation, uh, the the surgical wound that is created will
Mhm.
heal.
Mhm.
Otherwise, the amputation levels will keep on increasing from the foot till the below knee, then above knee till the hip. So if the wound does
Oh,
not heal, there is blackening called gangrene that will set in,
yeah.
blackening of the
Okay.
wound, because there's no blood supply. Wherever there's no blood supply, the flesh will start becoming stale, and then it will lead to gangrene. So again, you'll have to
Oh,
do a revision amputation or revision debridement. Again, keep going up and up till you reach the hip, and almost
okay.
you've eaten up the entire person's leg. So it's
Oh,
very, very
okay.
important to know all certain things that are there.
Okay. So, doctor, as you mentioned that amputation is basically the last resort. So, can you just tell us that what factors typically lead to this decision? Like, how can the doctors actually work to prevent it?
Right. So I would like to, start answering this question with an example. So if, for
Okay.
example, a
Sure.
person is taking non-veg, say chicken,
Yeah.
hmm, we
Okay.
see live chicken roaming all over the place, in the
Mm-hmm.
farm and everything. So once the
Mm-hmm.
chicken is culled, and you take a piece of meat and leave it on the table,
Mm-hmm.
it takes a few days or a couple of days or whatever, it starts smelling. Of course, it becomes
Yeah.
stale,
Right.
it
True.
disintegrates. But a live
Mm-hmm.
chicken is always roaming around because the blood supply is there for the live chicken. But for the dead chicken, there's no active blood supply to it. So it's just that blob of mass that is there that will just disintegrate. Similarly, in the foot, if there is no good blood supply, there are three vessels that carry blood to the vessels there. And you should understand, minimum two vessels should be there to preserve the foot. So
Okay.
two
Okay.
vessels should be there to preserve the foot. So the one thing you should understand, that if there is no blood supply to that particular area, blood carries oxygen, nutrition to that tissues. So if those tissues are hypoperfused, means don't get enough perfusion, they will start rotting. The cells will start dying.
Okay.
That is why it
Okay.
turns black and starts smelling. Okay, if you've ever seen
Oh.
gangrene patients, If you have
Yeah.
ever come across them, their foot smells
Yes.
like anything because it is
Yeah.
like rotting away.
True.
Those
True. True.
conditions, you may have to, once you turn black, there is no reversal. You should understand. Once that piece of
Hmm.
meat left on the table starts disintegrating and smelling, there's no way you can turn it fresh. It can only be cut
So
and thrown. Similarly,
right.
once the blackening or the the line of demarcation that they call it, that sets in, then you have to amputate the leg. Again, the levels of amputation is decided by the surgeon and the vascular surgeon who's there, who decides, till where is the good blood supply, and if improvement can be done for the blood supply, then they plan for an angioplasty or an angiography plus minus plasty and see, okay, if that improvement can be done, or if any surgical intervention like a bypass. Similarly, like in heart, we
Okay.
do a bypass when the vessels are blocked. Open
Yeah.
surgery, in open surgery, we do a bypass, taking from the upper vessel to the lower vessels, like a bypass. We're creating a highway so that the blood flow improves. But now that also
Okay.
has significant complications. If the person is having this problem for many, many days, and there's so much toxic cells and toxic content that has been generated by the dying cells, and you have
Mhm.
created a highway, definitely there is a possibility of that toxic material going back into the bloodstream and becoming systemic.
Oh.
So you have established a pathway for good, but it's called reperfusion injury. I have created a new pathway or channel, thinking my blood flow will improve to that area, but there is a risk of all the toxins and all coming back into the system and becoming septic. So that is a very,
Okay.
very common problem that they find after they create a highway or a reperfusion that is done. So yes, you need to understand that even though amputation is the last resort, if your blood supply to that area is not adequate, even after amputation, the amputate stump that is there, that can become gangrenous. And then again, you'll have to do a revision amputation, go higher up on the leg and do the surgery
Oh.
again. So multiple surgeries can be, of course, traumatic to the patient, mental trauma to the
True.
patient, financial burden to the family, and of course, the quality of life is definitely hampered.
Okay. Okay. Like we were really unaware that we thought that okay, that amputation is the last resort, but then you told us that you have to go redo everything again, like start it from a higher version again. Like the amputation has to be done. So that would be really traumatic for the patient, obviously. So doctor, like from the doctor's perspective, what are the key challenges in managing a chronic diabetic foot patients, and like how can it be mitigated?
So first of all, understanding and empathizing them with them is very, very important. These patients have gone to multiple doctors because of their non-healing ulcers. So convincing them that yes, even though you have diabetic foot, it is going to take further some more time to heal, or it may or may not heal, or you may have to continue a long, long time with daily dressings and other modalities. So making them making understanding their mental aspect is definitely a very, very challenging part for a
Challenge.
doctor, because of course they would have
Hmm.
gone to multiple doctors, even doctors better than you. Okay.
Right.
And they wouldn't have been able to cure this guy and the patient, and then he's come to you, and then first building up his trust is very, very important. Understanding and
True.
making him understand what his problem. Sometimes some patients will still be in denial. They will, even though
Right.
it has turned black, even though his foot has turned black, they will not be willing for amputation. So that black area initially might be of the just the thumb. Imagine if this is my foot, it might be only of the thumb,
Hmm.
but it can progress to the other toes. It can keep progressing. Initially, he would have settled with only a thumb amputation, foot
Hmm.
thumb amputation, great toe, where they call it. But now
Yeah.
he needs to undergo all the four uh, toes, or say
Toes.
above the ankle, because he has not progressed in time. He has not taken care or heeded to the advice of the doctor and just kept going from second opinion to third opinion. Because once it's black and once somebody offers amputation to the patient, definitely the patient will not, may or may not agree to the doctor, because it is his life, it is his limb that is going to get chopped off. So that he may see, okay, let me try another doctor, and getting into an appointment, showing the doctor, getting the test done, he already loses time. So
Yeah.
even though amputation, very, very important, take a second opinion. If you think, yes, that needs to be done, then definitely go for amputation. And there are early rehabilitative techniques. Life does not end there. Even after amputation, there is
Okay.
definitely orthotic devices that literally,
Mm.
get the patient
Mm.
back on their walking sense. In the sense, they may be able to drive cars, they may be able to, do activities like a normal person. But yes, that itself is a different specialty. Orthotics department who make custom made, legs, custom made
Mm.
plastic
Mm.
legs, as very commonly, it is said, plastic legs. So that
Yeah.
it is made, it is tried with the patient. Sometimes the surgery for the amputation that is done, that it has to be done in such a way so that it fits in to the artificial leg, and it should not form any ulcer. Sometimes the edges are sharp, so that may poke into the side of the stump and form an ulcer there, and that will form your diabetic related, and he's already diabetic, and then that may not heal. So the orthotic department plays a very, very important role. Physiotherapists play a very important role in ambulation with this plastic leg or this artificial leg implant. And once they are able to walk, and they manage, once they wear pants, nobody will say that their patient has undergone amputation.
Yeah.
So
Okay.
definitely rehabilitation part by orthotics and the physical medicine and rehabilitation team plays a very, very important role in post amputee patients. Of course, pre-amputation, you will have to always undergo counseling. You have to help them undergo
Mm.
counseling, understand, because it is definitely a mental trauma for somebody who's waking up after surgery to see his leg cut off.
True.
And that itself is a very sorrowful thing for the patient as well as for the family who is standing
True.
beside him. Yeah.
True. That's so true. Really, Doctor, this was like all of this information was really insightful, and I think our viewers are going to really get good help from all of this. So, in this way, going forward, I would really like you to share your top three pieces of advice which you would like to give to the MBBS doctors and the medical professionals when dealing with a diabetic foot patient.
First of all, identify the disease early, check for sugars.
Hmm.
Age is not just a simple criteria. Earlier, diabetics used to be from the elderly, but nowadays, a
Yeah,
lot of young patients and young populations have started coming up with
so true.
diabetes or type 1 diabetes. Look into the foot aspect. If somebody has come with diabetes, high sugars, and
Hmm.
recording, and then always do a complete assessment, which includes a foot assessment as well. And foot assessment, as in there are special devices that are available. But if you are in a peripheral setting, you may not have those devices for understanding the pressure of the foot and the risk areas of the foot. It's called a podiatry chart. What
Okay.
exactly is a sensory chart of your foot,
Hmm.
understanding different sensory areas of the foot. So very, very important to understand and teach the patients early, educate them about
True.
foot care, and prevent, wear shoes, very, very important. And don't wear the thin soled shoes. What happens is,
Okay.
if a nail goes through, they will not be able to identify because they will not have pain, as the
Pain.
sensory
Right.
sensation is very, very poor. So have wear something like a thick sole shoes, that are their sport shoes is what they say, because they have very good cushioning effect. MCR
Yeah.
slippers and sandals are there, a microcellularized rubber. It's very, very soft, made definitely. Initially used to be marketed to leprosy patients, because leprosy patients also did not have sensation in their foot. And what happens is something, and some rodent or something bites off and forms an ulcer there, and they would not know while they're sleeping. So
Okay.
these and form of injuries were very common in those class of patients. So MCR is really a good novelty that could be that I would say for diabetic patients. It really helps them, provide that cushioning effect and safety while walking. So yes,
Okay.
educate early, identify the disease, and once the disease sets in, definitely involve a multi-modality disciplinary team, and make sure, if you don't have that, refer the patient to a center that is there, because if you act early, the patient can prevent an amputation.
Okay, great, great. So, Doctor, one last question to you would be like, obviously, when talking about technology, we know how fast it is growing. So, what role do you see that the technology is playing in the future of diabetic foot care, such as the telemedicine or the AI-powered diagnostics?
Right. So nowadays, people are getting more and more educated. They are having their point of care devices. By point of care devices, I mean these small glucometers that are even easily available on in the medical store. Many, at least one in 3 or 4 households have their own. Or if you have a diabetic at home, definitely there is a high chance that you will have a glucometer. So
Yeah.
I think so. First of all, education is very important. So release of flyers and attending webinars like these and podcasts. Understanding foot care is the role of foot care, that is very important in preventing diabetic foot. So yes, if they develop and any form of that, and they're not able to reach the hospital, definitely telemedicine is a very good source, because they will have a point, the patient will have this glucometer which says, okay, 300 sugars, and he has an
Hmm.
ulcer on his foot. Definitely, he consults a doctor online. The doctor will ask him to be referred to a nearest clinic for daily dressings, because dressings cannot be done through online. It has to be
True.
seen, felt, and done. So yes, very important. He needs to be ideally seen by multidisciplinary team, and definitely a psychiatrist or a psychologist role is very important. And AI powered diagnostics, yes, nowadays, of late, maybe last 6 months, there are these newer devices, especially by they're made by companies that deal with diabetic foot patients.
Okay.
So if there's an ulcer, there can always be bacteria growth. There can be a possible bacteria growth, because bacteria feeds on sugar, right?
Okay.
And your
Yeah, right.
blood sugars are already high, and
True.
wherever, and the ulcer is open. So definitely
Hmm.
it is a hub or a harbor for possible bacteria to grow. So there are these devices, AI powered devices. You take a photograph and they'll tell you what bacteria, or what culture, positive, gram positive
Yeah.
or gram negative culture that is being growing, and then based on that they will give you a sensitivity chart of understand. That's quite instant. Earlier, the cultures still take about 3 days for the report to come, 3 to 5 days for the
Okay.
culture to be grown in the lab, and then you tell
Hmm.
which bacteria it is, and then you do a sensitivity test, and then you give them antibiotics. So here,
Okay.
the special device looks at it and then says, okay, it's a gram positive or gram negative bacteria. It's totally AI driven, and based on that, they can, based on the antibiogram of that particular area, you can always prescribe the patient on antibiotics, and not prolonged antibiotics only for a set course, and
Okay.
once to kill the bacteria, and daily testings as per the wound. So yes,
Okay.
definitely this technology and AI is a very boon for these
Boom.
patients, and definitely looking at AI powered diagnostics, that definitely has a major role.
Great, great, doctor. Really, I mean, we really enjoyed the session, and it was a really insightful one. And I really hope that this session helps a lot of viewers who have gained a lot of knowledge from you from this session. So thank you so much for sharing all of your knowledge and especially for sharing your precious time with us. So thank you so much, Dr. Allen. It was really great to have you on our podcast. And for our viewers, I would really like to thank you for watching our podcast. And if you really like our video, do like this video, this podcast, and do comment below regarding your feedbacks. And if you want us to cover any further topics related, we will definitely look forward for your feedback. And do subscribe us to keep tuned to our Mediversal Academy podcast. Thank you.